Cleocin Cream with Applicator is a medication used to treat a specific type of vaginal infection known as bacterial vaginosis. It contains clindamycin, which is an antibiotic that works by stopping the growth of bacteria. It is important to follow the precautions regarding the use of this medication during pregnancy. The cream should be applied as directed by your doctor, usually once daily before bedtime. It is important to continue using this medication for the full prescribed length of time, even if symptoms improve before the infection is completely cleared. In this video, we will be talking about Cleocin Cream with Applicator, a medication used for vaginal use. Before using this medication, make sure to wash your hands and read the patient information leaflet for proper instructions. It's important to avoid getting the cream in your eyes and to wash your hands before and after each application. To use the applicator, fill it with the cream according to the directions and insert it high into the vagina, then press the plunger to release the medication. It's typically used once a day at bedtime, and if you have extra applicators, discard each one after use. If you have only one applicator, clean it with warm soapy water and rinse well, but do not boil or use hot water to clean it. To prevent leaking, lie down as soon as possible after use. It's important to use this medication at evenly spaced intervals to keep the amount of medicine in your body at a constant level. Make sure to continue using the medication for the full time prescribed, even if symptoms disappear, as stopping too early may result in a return of the infection. And as always, be sure to tell your doctor if your condition lasts or gets worse. Some common side effects of Cleocin Cream with Applicator may include mild diarrhea, stomach upset, vaginal pain, burning, itching, or unusual discharge. These symptoms could be signs of a new vaginal infection or a fungal infection in another part of your body. It's important to contact your doctor if you notice any changes in your symptoms or if you experience any serious side effects such as pain when urinating, lower back pain, abnormal vaginal bleeding, or severe intestinal issues. If you have any signs of a serious allergic reaction, seek medical help immediately. Remember to contact your doctor for any concerns or side effects, and do not use any anti-diarrhea or opioid products without consulting your doctor first. Before using Cleocin Cream with Applicator, make sure to inform your doctor if you are allergic to clindamycin, lincomycin, or any other allergies. This cream may contain inactive ingredients that can cause allergic reactions, so it's important to discuss this with your pharmacist. Inform your doctor about your medical history, especially if you have intestinal diseases such as C. difficile-associated diarrhea, enteritis, or ulcerative colitis. While using this medication, avoid vaginal intercourse, tampons, or douches, as they can affect the effectiveness of the cream. The mineral oil in this cream can weaken latex condoms and diaphragms, so it's important to use alternative forms of barrier protection or birth control during treatment and for 72 hours after treatment is over. Talk to your doctor about other options, such as polyurethane condoms. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, use this medication only if clearly needed. Consult your doctor to discuss the risks and benefits, especially if you have a high-risk pregnancy. It is not known if the medication in this cream passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware that Cleocin Cream with Applicator may interact with other medications, potentially affecting how they work or increasing the risk of serious side effects. It's crucial to inform your doctor and pharmacist about all the products you use, including prescription and non-prescription drugs, as well as herbal products. Do not make any changes to your medication dosage without consulting your doctor first. Always seek professional medical advice before making any adjustments to your medication routine. If you or someone else has taken too much Cleocin Cream with Applicator and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Remember, this medication can be harmful if swallowed, so it's crucial to take the appropriate precautions. It's important not to share your Cleocin Cream with Applicator with anyone else. This medication has been prescribed specifically for your current condition, and should not be used for any other infection unless your doctor advises you to do so. If you forget to use a dose, use it when you remember. If it's almost time for the next dose, skip the missed dose and use the next dose at the regular time. Do not take an extra dose to make up for the missed one. When it comes to storing Cleocin cream with applicator, it's important to keep it at room temperature and away from light and moisture. Make sure not to store it in the bathroom and protect it from freezing. And remember, always keep medications out of reach of children and pets. When it comes time to discard the product, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it's expired or no longer needed. If you're not sure how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.